Hello students, we thought we'd show you a quick tour of the heart. The first thing that I'd like to point out is that a lot of times in the atlases it almost looks like the heart is in this orientation, but in reality it's actually turned so that the right part of the heart is really more superficial, if you will, and then it's also tilted, so it's almost like it's offering the right ventricle. For instance, if you had trauma to the chest, many times the right ventricle is most affected. The right atrium is a little bit more protected, and certainly the left ventricle is much more protected. So again, it's not like this, but it's actually turned and tilted like that. Let's start by talking about return from the body, blood return from the body through the superior vena cava here and the inferior vena cava here. Of course, inferior vena cava draining the lower half of the body, superior vena cava draining the head and upper extremities. Here is the right atrium, and one thing that's sometimes difficult for students is to orient, to figure out, is this the front of the heart or the back of the heart when you're looking at an actual heart. The thing that I'll look for is right here. This is the auricle, and to me it almost looks like a dog ear, so I kind of look for that, and I look for the one that's found also on the other side. Once you've kind of found the dog ears, you know this is either the front or the back. The next thing that I'll look for is I'll look for the great vessels, or for the tubes. And I know here on the model it almost looks like they're back here, but really in the human hearts this is going to look relatively flat, and on the human hearts you're going to see the great vessels in front. And again, just to use an analogy, sounds kind of crazy, but these two look like two big rigatoni to me. So once I find the dog ears, one on either side, I'll look for the rigatoni. I see the rigatoni in front, then I know my orientation. So hopefully that'll help you and won't be confusing. So here we are in the right atrium. I'll open this up a bit. One area that I wanted to point to, actually on the model here it looks very, very smooth, but on the real human heart you're going to notice some trabeculation here. You're going to see some crisscross pattern of the musculature, and that's called pectinate muscle. It's sort of embryologic remnant. It's from when the heart first developed. And the way that I think about it, I'm not sure if it's necessarily true or not, but because the right atrium is receiving blood from the body, it needs more structural integrity to sort of accommodate that blood, versus the left side of the heart. When you look in the left atrium, it is going to be actually very smooth with no pectinate. And the way that I think about it is because the left side of the heart is receiving blood from the lungs, which is kind of a low pressure system, it doesn't need that structural integrity. So one thing that you'll notice on the human hearts is that there'll be pectinate, and that's one way if you're confused, or if for instance we tagged a valve and you weren't sure if you were in the right atrium or the left atrium, look for that pectinate, and that is going to clue you in. If you see the pectinate, you're on the right side of the heart. If you don't see the pectinate and it's very smooth, you're on the left side of the heart. So let's go ahead and take a look at that valve. And here would be, of course, our tricuspid valve. It has 3 cusps, and once blood actually enters through that valve, it will be in the right ventricle. You'll also notice on the real human heart, the right ventricle wall is relatively thin as compared to the left ventricle, and again on this model it's not exactly accurate. It shows it a little bit thicker on the left, but you're going to notice on the human hearts bigger variability. It's going to be quite thin on the right and much, much thicker on the left. You'll also notice this trabeculation, or trabeculae carnae, and that's just sort of the structural integrity, the inner musculature of the heart. Attached to that, or coming from that, you'll see these papillary muscles, and they're going to be attached to these chordae tendineae. And you'll see that, of course, between the atrium and the ventricle on both sides of the heart, and you won't see papillary muscles and chordae tendineae when we start talking about the semilunar valves. The purpose of these papillary muscles and chordae tendineae, they don't actually pull and open the cusps of the valves. These valves work purely from pressure. So if there's a higher pressure and a lower pressure, that's how it works. Simply what they do is they're like tethers on a tent. If you imagine a tent in a windstorm, these tethers don't really pull. They're not intrinsically pulling, but they're just keeping the cusp from sort of going back and prolapsing in the opposite direction. Moving on then to the semilunar valves, and I'm not sure how well we'll be able to see these, but we'll attempt to show you the semilunar valves. They have 3 cusps, and again, they're not attached by chordae. This first one here being the pulmonary semilunar valve. That little blood cell that we talked about is going to actually go up through here into the pulmonary trunk. You'll notice the pulmonary trunk in this particular model is blue, indicating that this is deoxygenated blood. But the thing to keep in mind that once through the pulmonary trunk, these are actually pulmonary arteries. So pulmonary arteries are carrying deoxygenated blood, and that's an area of confusion. Just remember the word artery means a vessel going away from the heart, and a vein is a vessel coming to the heart. It's not always true that a vein is carrying deoxygenated blood and an artery is always carrying oxygenated blood, because here's an example where that's not the case. Once this blood cell goes to the lungs, it becomes oxygenated, and it comes back through one of 4 pulmonary veins. So you'll see them right here, 1, 2, 3, 4. On some of the human hearts you won't see all 4. You'll see sometimes this opening has been enlarged and you just see one big opening. So just know that in the human there are 4, but on some of our human specimens this area has been damaged a bit. But these are your pulmonary veins, again carrying oxygenated blood. Your blood cell is now in the left atrium, which will kind of remove this portion, and you can kind of see here's your left atrium here. From that point, the little blood cell is going to go through this valve, and this might be a tricky shot. Actually, let's try it from inferior. We'll go this way. You can see I'll kind of put my pointer through bicuspid valve, or the also known as the mitral valve, and this one again has the cusps as well as the chordae tendineae, the papillary muscles. The other thing that's important over here on the right side, we talked about the tricuspid valve being 3. The bicuspid or the mitral has 2. And again, we said the semilunars all had 3. Here's in fact a good shot of the semilunars from the top. Here's the one we talked about previously. That was the pulmonary semilunar. And in a moment we'll talk about the aortic semilunar. And you can see if that blood cell is in the left ventricle, it's going to go up through the aorta, through these semilunar valves, and at this point I've kind of removed the aortic arch, but you'll just for a moment I'll put it back here. Here's your aorta. From here, here's your ascending aorta, sort of your aortic arch, and then your descending thoracic aorta. Wanted to just point on a couple of things, and it's sort of hidden behind our subclavians here, but the brachiocephalic trunk is the first branch of the aorta, and it's going to have 2 branches from it, the right subclavian and the right common carotid. And from here you remember the common carotid branches into an internal, a right internal carotid and a right external carotid. The internal going into the brain, the external having a number of branches in the neck and head. So this brachiocephalic trunk is sort of the first portion from the aorta, and then it immediately splits again into the right subclavian and the right common carotid. The next one is the left common carotid. Now again, this left common carotid is going to have 2 major branches. It's going to have the left internal carotid going to the head and the left external carotid that has all the branches to the neck and face and such. And then this third branch off the aorta, so again there was the brachiocephalic trunk, the left common carotid, and the left subclavian is its own trunk coming off the aorta, whereas over here on the right we talked about the right subclavian really came off of the brachiocephalic trunk first. So the little bit of difference in symmetry between the 2 sides. Okay, from this point, that's really sort of the circulation of the heart. What I'd like to talk to you about next is the actual circulation of the heart itself. So I'm going to kind of put the heart back together a little bit here, although I will remove this section. The aorta is sort of greedy in that it wants to kind of get the first dibs on blood supply. And so here we are again in the aorta. Here's our semilunar valve. Directly above that aortic semilunar valve, there are going to be 2 little ostia, or 2 little holes. Don't see them well on a model, but on a human heart you're going to see a little ostia right here. You're going to see a little ostia or hole right here. For a moment I'm just going to take this right auricle and remove it, and we'll start on the right side. So if you follow this right ostia, this is a little little opening right above the aortic semilunar valves where blood is going to go through that ostia, and it is going to go into the right coronary artery. This is a very important artery that's going to feed the right portion of the heart as well as the posterior aspect of the heart. In fact, in humans, 85% of the posterior aspect of the heart, or back here, is coming from the right side circulation. So that's an important consideration. So here we are in the right coronary artery. It's going to send off a number of branches. The one that we want to concentrate on is the one right here. And just know that in the human hearts there's going to be a lot of variation. Even on this model they've drawn in another artery here. We're not going to talk about this one. The one that I want to talk about is right here, sort of on the lateral aspect. It's going to vary somewhat, but it'll be in this location on the human hearts that you look at, and look at a number of them to get a good representation. But this one is going to be called the right marginal artery, and it's going to take care of really this aspect of the right heart. From here we're going to look posteriorly. We're going to continue around with that right coronary artery. We're going to come around to the complete back side of the heart, and underneath this blue vein, and I wish the model had accentuated it a little bit more, is this artery is going to actually shoot down. It's sort of hidden underneath the blue vein. That is going to be your posterior descending artery, and that's the main feeder of the posterior aspect of the heart in most humans. So let's go ahead and go back through that just once again. Right coronary artery, marginal artery, continues around with the right coronary artery, and then once it sort of hits here and heads down, it's called the posterior descending artery, or the PDA. Let's go to the left side of the heart now. So here was our aorta, here was our semilunar valves, and right here through this little ostia is going to be your left coronary artery. And that left coronary artery immediately splits, almost immediately splits into an artery that goes down the front of the heart and an artery that kind of comes around, much like the right did, and circles around in between sort of the fat that lives in between the atria and the ventricle. So let's talk about the one that goes down the front of the heart, and that's going to be your left anterior descending artery. This is a very, very important artery, particularly in coronary artery bypass grafting. Almost always is this particular artery affected, or the LAD, the left anterior descending, is almost always one of the vessels that is blocked when you're doing an open heart surgery procedure. So the LAD, or left anterior descending, coming off the left main or the left coronary artery. The next one that we'll talk about is the one that circles around, and it's called the circumflex, and it kind of circles around in this groove. They've really made prominent veins here, but underneath would be our artery. I'm just going to sort of close this for a second, and if you followed it around, it's going to come around here. Don't worry about some of these branches. There are a number of different obliques, and again, there's variation. The thing I want you to know is the circumflex comes around, and at this point it can do a number of different things. Sometimes that circumflex actually comes across and sort of anastomoses with what was the right coronary artery, and then they send that one branch together. Sometimes it sends down a parallel branch of its own, sort of supplying posterior aspect of the heart, much like the PDA did. It sort of helps out. Sometimes it kind of does an oblique little thing and hitches a ride over here. It can do wherever it wants to. There's a ton of variation. I just want you to know, like, if we were to tag something over here, it's the circumflex. Don't worry again about these obliques, and I wouldn't even worry about what this is called right here, because it can sort of vary and have some interesting different variations. So again, left main or left coronary artery, the left anterior descending, and the circumflex. That's what we really would like for you to appreciate. It's also important to know that these little ostia, these little holes, are the place where if a catheter was placed through the femoral artery in the leg, in the thigh, in the groin, and actually snaked up all the way through the aorta, the thoracic aorta, come through the arch, you could act that catheter tip right here at the right coronary artery ostia, or, I'm sorry, I'm pointing to the left coronary artery ostia or the right coronary artery ostia, inject a little dye and actually see these vessels, and that's exactly what's done to determine blockages, where their location is, and there's a lot of interesting anatomy and variation, but these are the main ones that you should be aware of. The other thing to appreciate at this point is we're going to talk a little bit about how does the blood then get back from the heart itself to the heart itself. So for instance, these are the vessels that feed the heart. Once the heart is sort of fed by all these branches and goes through sort of a capillary network, it comes back through veins. So let's talk about those veins. A few of them that we want to concentrate on. When we talked about the LAD, or the left anterior descending, that vein that sits next to it or with it, that's going to be the great cardiac vein. And the way that I remember it is just because that LAD is such, it's kind of like the big daddy of the heart. It deserves the great cardiac vein. And I wish the model showed this as a great vein. It doesn't look all that significant here, but it's big. It's real important. The other one that we're going to talk about, we're going to just jump over here to the right side of the heart. The one that the vein that we have that correlates with the marginal artery is the small cardiac vein. You know, this little marginal artery it's important, but it's not that big of a deal in the scheme of things. So it gets kind of like the small cardiac vein. And the third one that I want to point out correlates with the PDA, or the posterior descending. And again, don't look at the size of these to get the names, but this vein right here is the middle cardiac vein, and that's a good name for it because the PDA is important. It takes care of a lot of the posterior aspect of the heart and really some of the inferior, when people have inferior MIs or myocardial infarctions. Sometimes this area is an area that, depending on its blood supply, really greatly affects how people present, if they present, and those kind of things. So this is the middle cardiac vein. All of these veins make their way to the posterior aspect of the heart. Some of these others we're not going to talk about, but this area right here in the posterior aspect of the heart is the coronary sinus. This is where all the veins drain into, and from that coronary sinus, and you can see these, you can see them very well on the human hearts. You can it dumps in, and I'm not sure how well the model shows us that it does this. It doesn't really show us all that well. But on the human hearts, if you were to look in this right atrium and look back here, you can actually put your finger or put a stick through to see where that coronary sinus right here dumps blood back into the heart. So those are the three that I want you to be aware of. Any of the others, don't worry about. The next thing I want to talk about is the fetal blood supply, or the fetal heart. Just a couple of quick points. Here we are again in the right atrium. And you'll notice this on some of the real human hearts that we have. There's a little area right here that you want to look at. Sometimes you'll actually see a depression, or sometimes if you even put your finger in here, you can almost make your way to the left atrium. In the fetal heart, remember that the blood that's in the right atrium just came through the umbilical area of the fetus from the mother, and so this is actually oxygenated blood. So we don't need to bother going down to the right ventricle and up through the pulmonary trunk and go to the lungs and waste all this time. We just want to get this nice oxygenated blood over to the left side so that it can get to the aorta and get to the rest of the fetal body. And so there is a hole here. That hole in the fetal heart is called the foramen ovale. In the adult, or shortly after birth even, that area is going to close, and the name for it once it's closed is fossa ovalis. So the way that I remember it is a foramen is a hole. So foramen ovale is open, that's in the fetal heart. Fossa ovalis with the S's, both of them have an S, that is in the adult situation, or at least the post-fetal situation. So that's an important little thing to keep in mind. Now, some of that blood isn't going to make it from the right to the left, and it's going to fall down through or be pumped through the tricuspid valve. It's going to make its way to the right ventricle. It's going to make its way up through this pulmonary trunk, and again, the lungs aren't working in this situation, and we want to get that blood that sort of made it through, we want to get it over to the left as quickly as possible, or get most of it. There's a communication. You're not going to see it here. In fact, it's probably in here. Oh yeah, here we go. On the model actually does a pretty good job of demonstrating this. And on the human heart, you're going to have a hard time trying to find it, but this would be the location, sort of between the aorta and the pulmonary trunk. It's just very connected in here, so you're not going to be able to isolate it. But this area, and in the model it's right here, in the fetal situation, this was open, and so that's called patent ductus arteriosus. In this case, patent meaning open, ductus arteriosus. In this case, the open area has the S's. So this is kind of something that I keep in mind. It's opposite what we talked about a minute ago. So if it's a patent ductus arteriosus, that's open. When it closes in the post-fetal situation or in the adult, that is now called the ligamentum arteriosum, the M's. So I think of a ligament as being something that's sort of closed, and it's not a ligament in the sense that muscles are a ligament, but they call it a ligamentum arteriosum. So again, to kind of go through that one more time because people get this confused a lot. Foramen ovale is open, fossa ovalis is closed, patent ductus arteriosus is the open situation, and ligamentum arteriosum with the M's is closed. So I hope that kind of helps with fetal circulation. I hope that helps with the coronary artery and vein anatomy, and then the general circulation of the heart. Good luck studying, and we're not able to show human hearts on the video due to the body donor program, so we're going to use the models to talk about this, but I encourage you to look at a model, also get a human heart or a number of human hearts, and look at the various features. Some hearts are going to have a great PDA, another heart's going to have a great coronary sinus. Look at a bunch of different ones so that you get a nice appreciation of all of this.